Welcome back. It has been a long time. It's good to see you, Richard.
Man, I wasn't sure what we were going to say.
I didn't know how to say.
You
It's
said,
been
welcome back. You know, there's a new commercial for one of the restaurants, and they're using the theme from Welcome Back, Kotter.
That's right.
So we should have had that theme music playing in the background, welcome back. No, it's been a very long time. The coronavirus has, as everybody knows, has upset everybody's life a little, including ours.
Yeah.
Everything changed, and one of the casualties was we weren't sure how to do podcasts under the news.
Exactly. And, there's been so much that's happened over the past couple of months with, our entire office shifted to virtual. So we're only doing teletherapy right now. And so we're never together anymore. And so there was that complication. And then for a while, for some reason, our podcast feed started having problems getting to iTunes. And so had to go through that whole process again. And there's been a few times that we talked about sitting down to record. And as you said, trying to figure out how in the world we're going to do that was a mess. So, but I think that we've got it. We're using Zoom like everybody else, I guess.
Right.
And hopefully the video comes out okay, so that when we post it on YouTube, it will look okay for folks who check out the podcast there.
Right. Yeah, but it's good to be back. And we're still struggling with the virus, and of course everybody is worldwide. But we spent 5 years developing a format for our podcast, and then suddenly one day it had to change. And
that's right.
It's been an adventure. So it's good to be back, though. It's nice to see you.
Yeah.
You look all, I forgot you wear bow ties, so yeah.
Well, you as well. That's right. The only times we ever see each other now are in passing in the morning. When I'm leaving at about 6 o'clock in the morning and you're getting there at 6 o'clock.
Right. Yeah. 2 ships passing in the night, but
that's right.
No. So you and I were casting about to say, well, when do we start? When do we redo our podcast in the new format? And what do we do? And suddenly this whole issue of school reopening burst on the scene. And we thought, well, what better topic than that to start with? It's a timely topic that's going to affect kids and families and school personnel, but it could affect absolutely everybody in the country. So this is an issue of importance, I think, to most of us.
Absolutely. And this will probably end up being a 2-part podcast, because there's so much information, so many things for folks to consider when thinking about, getting back to school and what all that means. Because I think that a lot of times we sit back and we think, well, of course, it's August. And so, well, it's almost August. So kids should be getting ready and we should be getting back to school. Here in Florida, schools usually start at the beginning of August. And I know that in other states, other areas of the country, kids go back after Memorial Day or into September. But, regardless, we're approaching that time where kids are getting back to school and we're kind of getting into that mode. But what does the COVID-19 and the coronavirus, the whole pandemic and everything, what does that mean as it relates to getting back to school? I was talking to somebody the other day and they were referring to teachers as essential workers. And so teachers need to be back at school and need to be back working, and kids need to be at school. And I think it's oftentimes really easy to think and to hold that perspective until you just start for a few minutes of thinking about what that actually means. And that's what we're going to try to focus on today.
Right. Yeah, we had 2 things happen. Our natural biorhythms, fall is coming, and that means the beginning of school. And then we enter the holiday season. But the other thing is everybody's tired of being locked in. Kids and parents have been together now 5 months.
Right.
We wrote about that the other day. The kids and families have been sort of quarantined. And so everybody's ready to get out, number one, and everybody's ready to get back to school. But we want to take a closer look at what that actually means. What are we talking about, and how do we do it safely?
Right, because there's a number of issues and concerns, and we sort of as we're saying, we think of it as just this is just what happens now.
Right.
And here in Florida, I know we have listeners and viewers from all over, but here in Florida, our state government made some decisions to get things moving and open back up very, very quickly. And
Right.
And certainly it's not causal, but you can see when you look at trend lines that the prevalence of coronavirus was relatively low, especially compared to some other places. And then as soon as we started making some of those changes, we have seen significant spikes, a significant increase in the number of cases.
Right.
And it's raised a lot of concerns for a lot of people, while at the same time, there are others who sort of remain unmoved as it relates to a relative lack of concern
Right.
with the prevalence of the virus. So
Right.
it's a very interesting phenomenon that's happening right now.
Right. Yep. Well, opening schools, like everything else related to this virus, as we're learning, it's very complicated. Fauci said the other day that this is a very complicated virus. It's a very difficult virus, and so, like everything else related to this virus, reopening schools is both a complicated issue and it's a contentious issue.
Right.
And it's complicated because when we talk about reopening schools, we tend to talk about children. What are the effects on children, and do they get sick, and do they get this, and do they get that? Well, yeah, children do get this disease. In fact, 77 have died, and 800 as of yesterday. Since January, there are children who are dying of this disease. There are children being sent to pediatric intensive care units, hundreds of them. And there's this Kawasaki-related disorder that could have kids who get it seem to get this inflammatory disease that affects their hearts and their circulatory system. So there are risks to children. But the other important thing is that children can have the disease, be asymptomatic, but can spread the disease. There was a study done in Korea this summer, and said that children over the age of 10 probably can spread the disease. They can maybe younger children don't, but older children do.
Well, and I think that's an important point, because we do hear that where people will say, even medical professionals will say, well, kids don't transmit the virus to adults. Some medical professionals will say that, and then you talk to other medical professionals, and they will sort of scratch their head and say, a virus doesn't know your age. And so if a person has a virus and that virus is spread through the air or through touch or through whatever, the virus doesn't say, oh, well, I'm in a 5-year-old, so I don't spread to adults. So that doesn't happen. And so, yeah, we're seeing cases where absolutely children spread the illness, the virus to adults.
Right.
And that raises the issue of, we as you say, we think oftentimes about kids being the big concern when it comes to returning to school, but yet we're forgetting the fact that, schools are filled with adults as well. And many of those adults are older adults, certainly over the age of 40. Many are over the age of 40, and some even older than that are in that significantly increased risk range category for significant response to the illness, not let alone the risk for death.
Right. Yeah, you talk about Florida reopening, when the bars and restaurants started to reopen, and the 20s and 20-somethings and 30-somethings, they aren't as concerned, because even if they get the disease, it's not that bad. Many have gotten it. So it's really not that bad. But Fauci did an interview a week or so ago and had a wonderful quote. He said, "It doesn't end with you. The chances are that you're going to infect someone else who will then infect someone else, and then someone who's vulnerable will get infected." Right. So you may not die, you may not get terribly sick and you may not get the disease, but if you spread it to others, eventually it's going to end up infecting somebody who is vulnerable. So we can't just talk about kids. We have to talk about who else is in that building.
Right.
And we're talking about teachers first, administrators, office staff, cafeteria workers, janitors, who's cleaning the building. We have, what about bus drivers?
Absolutely. That's a massive issue, because
right.
Some of the schools, there's a school that I work at where there's anywhere between 50 and about 65 students on a bus at a time.
Right. That's not going to happen this year.
And so those buses are loaded down. And in a recent school board meeting around here, they were saying that to do what would be recommended as it relates to busing kids, just about every bus would have to triple their at least triple their drives, their routes. There's no way.
No. And that's to and from.
Right.
You have to do that 2 times a day.
Right. So you'd be significantly increasing the school day, and people were talking about some of the logistical things. We'll have bus drivers and these bus attendants check temperatures before the kids get on. Well, what happens with that? So if a kid has an elevated temperature, where are you going to send them? You can't send them back home because you don't even know if there's anybody home.
Right. Put them out in the street.
Right.
What if he's 5 or 6 years old?
Exactly. So there's so many other aspects to it that so many folks that often folks don't consider.
That's right.
It's not just yes, we should go back to school. We all agree that the kids should be back in school. Right. I don't think anybody disagrees with that, but it is a complicated issue.
Yeah. And then these kids are going to go home. So you put them all together in a school, which increases the possibility of transmission. Then you send them home, and they're now potentially bringing the infection into their homes.
Right.
And then you have to think of all the people who are in their homes.
Right.
So
think of some of the elementary schools that have 800 students.
Right. Mm-hmm.
So if one student comes in there, or if 1% of the students in there has it, that's 8 kids that's going to spread it to, and it's just going to multiply.
8 kids go to their families, and if each family has a couple of, do the arithmetic.
Right.
It expands in a hurry. So, that's a fear. So it's not just about the children and what effect it's going to have on them and whether they spread it or not. They do spread it. But how's that going to affect? Because you not only have the safety, when we talk about safety, it's not just the safety in the school. It's schools have to somehow prevent the spread of the disease. Right. They don't want to be like bars and restaurants who, they opened up and suddenly there was a surge. So it's a complicated issue for sure. It's also become a very contentious issue. And this is, to me, it's troublesome. It's a little bit sad, but it's also produces a little bit of distress and anger in me, because there's no reason why it had to become a contentious issue, but it has. And we should be relying on experts from the Centers for Disease Control, the World Health Organization, people who have spent, like Fauci. Fauci's 79 years old. He's been doing this for 50 years. Right. The CDC knows about infectious diseases, and there are infectious disease specialists around the country in medical schools who know about this disease. And that's who should have been providing us guidance in how to reopen our schools. But instead, the experts who should be providing that information are having difficulty having their voices heard, while politicians and are making demands that you must reopen your schools, and that it's become a divisive issue. Because on the one hand, you have infectious disease specialists trying to get the word out, and you have another group of people who are pushing science to the side. And I'm going to talk about that a lot in this article.
Right. Well, and it's troublesome that it has become politicized, because in the cultural climate that we live in right now,
Right.
our two branches, our two wings, have become so polarized,
Right.
that if you're on the right, you have to believe this way, and if you're on the left, you have to believe that way.
Right.
And so it doesn't allow us to have effective communication, so that we can actually make plans and create programs and create contingencies for dealing with these kinds of issues, because we can't even communicate. When you have politicians going on that says that, that's completely minimizing it, and saying that it's not a big deal, we shouldn't worry about it. And then another politician that comes on and says, no, we need to do all of these other things. We're on these extremes, and they fluctuate and they change from day to day. And, it really makes people confused. Politicians are not disease experts.
Right.
And while we may work really hard to believe that they are making decisions that are really informed by people who are knowledgeable about diseases and things, they're not necessarily making decisions based upon that information. And we have to recognize that.
I'm glad you brought that up.
Because Florida opening bars and restaurants had absolutely nothing to do with us effectively managing the coronavirus.
Right.
It had to do with economics.
Right.
For goodness sakes, Disney was closed.
Yep.
So so much of Florida's income is tourism based. And so we had to open things back up just to save the economy. Well, that has nothing to do with, safety or risk for with the coronavirus. And, so politicians are making decisions based upon other things. And so we need to take those things into consideration.
That's right. In our country, and I think Florida is a good example. Florida depends on tourism. Florida depends on people coming from all over the world,
right,
to come to Disney, to come to the beaches, to come to the theme parks that we have here. Okay, so our economy is based on tourism. When you shut that down and say people can't come here anymore, that has a profound effect. There are many states in the country where they don't depend on tourism.
Right.
So it's a completely different situation from state to state. Okay, so but still every state has the obligation, regardless of how your economy works, every state has the obligation to stop the spread of the disease. Okay, and so you have the infectious disease people, the specialists, are saying our obligation is to stop the disease. That should be the focus. That should be the primary goal. Okay, but it isn't always the primary goal, and that's what we're seeing in our country today. Is you have mainly politicians and media outlets. I don't call them news channels anymore, but because it's not really news. But you have media outlets and politicians pushing another agenda,
right?
And it's not the agenda of the infectious disease specialists. It's economics and politics and elections and other reasons. For example, President Trump made a decision the other day to have hospitals report to Health and Human Services rather than to CDC. CDC needs the data from hospitals. So right in the middle of a pandemic, we have this enormous policy change, okay? Now, it takes time to make those policy changes, and you're doing it in the middle of a pandemic. And what it does is it creates confusion and chaos, because people are saying, well, how do I make my decisions? Well, I'm gonna go to CDC. Well, CDC doesn't get the data anymore.
Right.
So, and those are the things we have to be careful of. And that's why this has become such a contentious issue. And you're right, people's decisions are being driven by their political opinions rather than their understanding of the disease. And that's created chaos for all of us.
Absolutely. And it does, and it filters down to of course, the topic that we're talking about today of going back to school. You know, there are those who, you know, are adamant in one direction, and you can tell that it's fueled, at least in large part, by political perspectives, as opposed, you know, in Florida, the last couple of weeks or so, the last time I looked, we've had almost 10,000 new cases of new diagnoses of coronavirus a day for the last couple of weeks. There were a couple of days where it was approaching 14 or 15, even 15,000 in individual days. So which is a significant increase from, you know, 2 months ago, where we were seeing maybe a couple of thousand a day. So, you know, we are seeing this massive increase, but our policies, our ideas, our plans aren't really changing all that much.
That's right. You know, a good example of that is we know that masks help. Okay, everybody know. We may not have known that 3 months ago, but there's information from all over the world that masks will slow the spread of this disease. And yet, last week, the governor of Georgia is suing the mayor of Atlanta because she implemented a mask mandate. Okay. In the meantime, the mayor of Washington, several days ago, 2 days ago, issued a mandate for the city of Washington that said if you don't wear a mask indoors and outdoors, you could be fined up to $1,000.
Yeah.
So we have that kind of confusion.
Right.
And instead of people working together, and what I would like to see is the politicians facilitate the scientific data information. Okay. Instead, we have politicians arguing with the scientists, pushing the scientists aside, and filing lawsuits against each other about a simple policy like wearing a mask.
Absolutely. And you know, again, in thinking about how this, when we're thinking about schools, you know, one of the things that some of us have been doing is looking at what other countries are doing, you know, what's happening in Germany, in France, and some of these other countries. And we see that they are, you know, some maybe a little bit more successfully than others, are implementing different strategies for dealing with this. But the massive issue really is that they have national guidelines that they're following. You know, so everybody in Germany, for example, is pretty much following the same rules and expectations. Here, as you were saying, you know, we have sort of folks on the national level saying certain things, people on the state level saying certain things, people on the local town-based saying different things, and they don't always match. They rarely really match. You know, we live in a relatively small area here in Polk County. You know, 10 miles to the east or west, you're going to hit either Orlando or Tampa.
That's right.
They're doing something completely different.
Completely different world. Right. That's right.
And so it doesn't make sense, because again, we're creating these policies and we're trying to implement these strategies, and Polk County schools will end up doing something completely different than Hillsborough County schools.
That's right.
And sometimes there are schools from the different counties that are almost across the street from each other.
That's right.
But
yeah, because we're on the border. Yeah.
Yeah.
It's going to be very different just a few miles from here.
Right.
Let alone for state to state. Okay?
Right.
So yeah, just a few miles will make a huge difference.
Right.
Yeah, we live a few miles from Disney World.
Right.
Well, but our world is very different. Our community is completely different than the community that contains Disney World.
Right. Right.
And yet they're just a few miles apart.
Right. So as we're thinking about, again, this very complicated and contentious issue of kids returning to school, it is very important that we think about, you know, all of these issues. We don't just focus on, yes, we agree that kids need to be back in school, but we need a really good plan for that. That takes into account not just what's happening to the kids at school, but also what the kids are taking home, what the teachers and administration and just the adults in general are being exposed to, and what they're taking home. And, you know,
Right.
what other options there are for managing all of this.
Right. Yeah. So where it puts us with all this divisiveness, and I mean, my goodness, the divisions existed in our country long before the virus arrived. And so the virus has exacerbated those differences. People are really angry at each other. We need to come together,
Right.
but instead we keep arguing with each other at very basic levels. And so as a result, the loudest voices in this pandemic are those who demand, on the one hand, demand that schools reopen, period, immediately, fully. And that would be, when Trump first started talking about it, he said they have to reopen fully. And we have the Secretary of Education, Betsy DeVos, who got on and demanded, and that was her word. She said, I demand that every school reopen fully for
Right.
all students 5 days a week. So on the one hand, you have those very loud voices demanding that schools open. At the other extreme, you have all those people who say, no, we're not ready we cannot under any circumstances reopen our schools, okay? Well, somewhere between those two is where the solution is going to reside, okay? But as you said a few minutes ago, everybody agrees that schools should reopen, okay? Right. I don't think anybody, no, we don't want schools to, of course we want schools to reopen. Why? Well, first of all, last spring, at the end of the last school year, online instruction isn't working for most of us. Okay, well, that's clear. Second, students with special needs are not served well by online instruction. Third, we learned that parents can't work from home and supervise their kids' education.
Which I think is a point that many people completely forget to even consider.
Right.
Because, if there were talks for a while, for example, about, well, what we'll do is sort of adopt this model that some of the other countries are doing where, students alternate. So some students will come to school on Monday, others will come on Tuesday, Monday's group will come back on Wednesday, Tuesday's group will come back on Thursday. And the first thing that came to my mind was, what happens to those parents who have young kids?
Right.
And so the parents have to be home every other day, or those kids are going to have to go to a childcare, which I'm not sure how going to childcare makes any different than going to school. Right. What if they have kids that, on one day you have a couple of kids one kid that goes to school on Monday and Wednesday and another kid that goes to school on Tuesday and Thursday?
What if you have 3 kids going to 3 different schools?
Right.
And they're on different schedules. That's going to happen.
Yeah.
Okay. Yeah. Right.
So it's, it's a very complicated issue.
Right. And, quite frankly, we're all, I don't know how to say this gently. Parents are tired of trying to keep their kids occupied.
Right.
When kids are locked down like this, there isn't a lot for them to do. Playgrounds are closed, swimming pools, everything's closed. Kids can't go out. They can't run around with their friends. They're not playing sports. Everything had been shut down early on. And quite frankly, parents don't know what to do with these kids 24 hours a day for days and days and days at a time.
And it's so interesting in sessions working with kids and parents right now, because we're dealing, how many times do we have to deal with that with and I completely appreciate their issues and their concerns, but parents are getting really frustrated with their kids who are playing video games all the time. Well, one of the questions I'm just starting to ask everybody is, what do you want them to do instead?
Right. Exactly.
Are they Are they doing their chores? Yeah, they're getting their chores done, but their chores take like 30 minutes, 45 minutes. Okay. So what are they going to do with the other 15 hours that they're awake every day? And so some parents will even say, well, I don't want him playing on video games the whole time. So, he can, join us and watch TV, or he could do, it's one screen or another screen. It's just a screen. And oftentimes playing video games, they're interacting with their friends from school, or something, which is really important for them to be doing. So I can completely appreciate the sort of dilemma that parents are finding themselves to be in. But at the same time, what do you do?
Mm-hmm. Mm-hmm.
there aren't many
Right.
options.
That's right. No, but everybody, because as people have said, you can't reopen the economy completely until you get kids back into school,
Absolutely.
because the parents have to be free to go back to work. Okay.
Absolutely.
However, we're talking about sending them back to school in the middle of a contagious and deadly, I mean, this is a deadly virus. It kills people.
Mhm.
And so we have to think about reopening in the context of this very complicated enemy, this very contagious, deadly, and very complicated virus that we're learning how to deal with it as we're having to deal with it.
Right.
And so, so we have to think about reopening schools in the context of the disease. Everybody agrees we should. We all agree on all the reasons why we should, but we have to do it in a way that assures the safety of not only the people who are going to be in the school building, but all the people who are going to be affected and possibly infected as those people leave that building and return to their homes and businesses.
Absolutely. So, absolutely. It's a multi-layered
right
problem.
Right.
And certain people at from different areas are only looking at one area, one level, one layer. Right. If you're only looking at the economics of it, you're going to make one decision. If you're looking at the public safety level, you're looking at another layer. So you have to look at multiple layers at one time.
Well, you bring it. That's an excellent point. Actually, that's a perfect segue for part 2 of this presentation. That you can look at this from the point of view of a politician seeking re-election, of a governor, of a business owner, of somebody who owns a sports team, somebody who wants college football to occur this year, somebody who wants their kid. Think of all those kids who are missing a whole season in their sporting career. Okay, oh, yeah. You're missing an entire season. If you're a minor league baseball player.
I think about all those high schoolers who need this athletic year, this sports year, to get scholarships for college.
That's right. This is their year, right? And it's taken away. Okay, and so and kids who want to go to college and need their senior year for one reason or another. So you have all these different perspectives, and what we want to talk about in part 2 is what perspective do we use when we talk about reopening the schools? Whose perspective do we use? Right. Okay, and I think that's been part of the problem here, is we have these different perspectives, none of which are really wrong. Right. But which one are we going to use to open schools in a way that ensures safety and that limits the spread of the disease even further? And that's what we want to talk about in part 2. Yeah. So we'll tackle that information in part 2. But so just to kind of wrap some of this into a nice little package. This is a complicated issue, and I don't think anyone doesn't want kids to go back to school. I think everyone is in agreement with that, and I think that we need to be mindful, though, that there are many aspects to this decision that we have to keep in mind, that we have to consider, and that needs to be, at least equally weighed. Some things require a little bit, should be weighted a little bit more when you're talking about the decisions that are being made. But we need to look at all of these aspects, look at all of the layers that we're going to talk about in part 2, and then make a decision and figure out what's going to be best, not just today, but next week, 2 weeks, when we would start seeing symptoms, and of course, months from now, when we're figuring out, post-pandemic life. So and you're right. We're trying to anticipate what problems might occur, and we just don't know. Okay, and so some things we really don't know. But there's a great deal we do know, so at least we know a starting point. Right, and we can go from there. Right.
Absolutely. So
okay.
All right. Well, that is it for today. It is nice to be back. I can't wait. We have lots of other things that we're going to talk about. Not just coronavirus stuff, but there are issues besides coronavirus that we need to talk about. Absolutely. So we're back. We're ready, and hopefully we'll continue to be in your feed every week moving forward. Maybe even more frequently than that if we can help it. So, all right. So until next time, stay happy, stay healthy, and forget to be afraid.